So today's question is, give reason. Injection site should be rotated while administering insulin. Why injection site should be rotated while administering insulin? That's our question. Yes, it is recommended to rotate the injection site while administering insulin. The reason behind is that in order to avoid lipodystrophy. What is lipodystrophy? Lipodystrophy is the abnormal distribution of adipose or fatty tissue under the skin, which we can see in the form of a dent or a lump under the skin, which occurs due to the repeated use of insulin injection at the same site. Okay, or in other words, we can say that it's a condition. Lipodystrophy is a condition affecting the subcutaneous fat tissue, which leads to lipoatrophy or lipohypertrophy. Lipoatrophy is the loss of subcutaneous fat, and lipohypertrophy is the lump or accumulation of fatty tissue under the skin. So what happens in lipodystrophy is that, or what happens if we are injecting the insulin injection at the same site, is that there occurs a lump or a fatty tissue accumulation. So here, when we are injecting the insulin injection, the absorption and the effectiveness is reduced there. Absorption won't take place properly. Okay, so which can lead to complication. The four anatomical sites. First is abdomen, back of the upper arm, front of the thigh, upper outer region of the buttocks. And if you are taking the abdomen, make sure that 2 inches away from the navel area. So these are the four sites, anatomical sites for taking insulin injection. Abdomen, back of the upper arm, front of the thigh, and upper outer area of the buttocks. So these are the four anatomical areas. So what we have to do is that our major concern is to prevent lipodystrophy or prevent the accumulation of fatty tissue under the skin. If there is an accumulation, I already told, it can lead to poor absorption of insulin injection, which can lead to complication for the patient. So what all things we can do in order to rotate the injection site? Okay. So first thing is choosing a different spot each time for each injection. You have to choose a different spot for each injection and different site for each injection among from this anatomical area. What we can do is that move 2 fingers along from the last injected site. So if you are injecting in the abdomen, whichever area, move 2 fingers along from the last injected site so that there is a gap. We are not injecting in the same point. Okay. Second thing is record of injection sites or record of the or tracking the injection sites, where you are given yesterday, where you are giving today, where you are supposed to give tomorrow. Tracking the injection sites is very important. Okay. Next is avoid injecting to the scar tissue, bruised area, infected area, and hypertrophied area. Okay, you should avoid giving insulin injections on these areas. Next is you should not try to use the same spot within 2 to 3 weeks. Okay, patient should not inject in the same spot within 2 to 3 weeks. After again our next rotation, we can take the injection on the same spot. Okay, repeated use or overuse of one spot is not good in taking the insulin injection, because why we are giving insulin injection to the patient? We are giving insulin injection to the patient for cure or protect the patient from complications, for effectiveness. Okay, so when the fatty tissue accumulation occurs, we are giving an injection onto the area or a lump area or a accumulated area, fatty tissue accumulated area, the insulin will not absorb properly. Okay, so should not overuse the same site. If at all, if you are using one site, should not use that same site within 2 to 3 weeks. And if the patient exercise, if the patient wants to do exercise, avoid taking insulin injection on that particular limb which has to be exercised. because what happens here is that insulin absorption takes place fast and the patient can goes to hypoglycemia. Next is if you are using insulin pen. You have seen insulin pen, right? The needle is too small. Medicine goes into the body very slowly. So keep the pen for 2 to 3 seconds, then remove the insulin pen. Our main importance here is the patient's comfort and patient's speedy recovery and avoid complications. So make sure that while giving insulin injection, rotate the injection site every day. Okay.